Well, with summer comes a lot of sun, and for some people that can mean lots of sweat. Nearly half of all Canadians say their sweating interferes with their daily life, but the latest treatment approved in Canada is helping patients stay dry. And now to find out if it worked, we're joined by Sean and dermatologist Dr. Noel Solish after this item. Sweat, and lots of it.
It has an impact on everything I do. It doesn't matter if I'm just going to school or if I'm exercising, whatever I'm doing, I'm sweating constantly. The only times I don't sweat is when I either am sitting with my arms raised like this. It's the only time I won't have sweat marks.
Sean is one of 300,000 Canadians who suffer from hyperhidrosis, or excessive sweating disorder.
Probably around like 4 or 5 years I've been dealing with this. Sometimes there'll be like a month or two period where it gets better or it gets worse, but it's always pretty steadily and pretty constant.
And for many Canadians, constantly disruptive. In fact, 50% feel sweating interferes with their daily lives.
Well, it's just really hard because I can't be wearing just a t-shirt in public unless it's black, because I know sitting there I'll have these huge marks on there, and like I just don't take off sweatshirts, or I won't wear just a dress shirt because it always shows through dress shirts.
And to make matters worse, Sean is a dancer.
And this isn't even usually as bad as I get. If I'm teaching 2 hours of class, I'll bring a shirt for the first hour and a shirt for the second hour.
I'm going to take you right into this room.
But there are medical solutions that can help.
The vast majority of time it's genetic. And there are things that can be done, from as simple as using strong antiperspirants to getting things like Botox injected.
Here's how it works.
There's a signal by the sweat gland that the nerve sends to tell the sweat gland to sweat. It's the same signal that tells us to move a muscle. So if I inject Botox around the sweat glands, the signal is blocked, and even though your body is telling it to sweat, then the signal won't get across, so people won't sweat.
The procedure takes 5 to 10 minutes. So Sean won't have to sweat it out anymore. And now we are joined by Sean Walsh and dermatologist Dr. Noel Solish in studio. And I guess to begin with, I mean, when was that treatment that we were just taking a look at?
Just over 2 weeks ago.
And so now?
And now there's nothing at all.
And was that, it was right away?
It started to work about a week in.
Okay.
And then I sweat a little, and then fully 2 weeks in, there was absolutely nothing.
And what a difference for you.
It's been amazing.
How old or new is this kind of treatment?
Well, the drug has been around a long time. We know it's very safe because it's been around since the 80s. And it first got used in about the 90s for sweating, for treating sweating. And it really hasn't caught on very much because a lot of people don't know that it exists as a good treatment option.
Because with 300,000 Canadians suffering from hyperhidrosis, you were saying that a lot of them would not know that there is anything available for them.
Exactly. They suffer in silence is what we say, and they don't even know to seek help from their physicians. And there's great options out there.
Was there any side effects at all for you?
None.
None. And when we talk about Botox, we're talking needles.
Yeah. It really didn't hurt.
Okay.
I was so nervous to get it done.
Were you?
Because I don't love needles, but it really did not hurt at all. It felt like a little pinch, a tiny bit.
Given the fact that you are a dancer and you teach dancing as well, I mean, this is you're constantly working out. You are constantly doing that. Tell me the difference between your life then without treatment and now.
Well, the biggest difference is now I don't sweat from my armpits. I'll sweat from other places, but it's more that in my daily life when I didn't need to sweat, I would be sweating, and now I wouldn't. I don't sweat out of other places because I'm not sweating on my armpits in my daily life. It's just that I don't need to sweat, and I don't.
And how many people, like, at what point does someone say, okay, this is normal sweat, and then, oh, maybe this isn't, and then they would know that they...
Right, and normally what I say, although we can measure it, it's important is it affecting your life, like Sean? Do you have to worry about what you're wearing? Are you afraid to put your arm up? Are you afraid to hug someone? And these are common things that happen to people that affect them with hyperhidrosis. And if it's bothering them like that, then I think they should get treatment.
Okay, Dr. Solish, Sean, thank you so much, both of you, for coming in this morning.
Thank you.
Thank you.
And now a country music legend.
Always got a smiling face, anytime and any place. And every time they ask me why, I just smile and say.
Everybody knows that voice, that rich baritone. It's wooed the hearts of